concern about the gloves that we actually produce. Is there any health risk or infection risk in the products produced at the factory, at the facility where some of the workers are actually infected? Just wondering if DTM has done any studies on that and if there's any results. Thank you.
Thank you very much. So I answer your third question first. So far, there's no reports of infection from the gloves. So the gloves goes through a certain processes, and we have seen there's no other reports been documented in terms of infection. Second is the workers, those positive cases will be isolated in the hospital and they'll be treated. But those negative but have exposed to a positive patient will be quarantined. So we already identified the place of quarantine, etc. They will be quarantined for 14 days. And yesterday is the first batch of those who have completed day 13. They have been tested. So if they are negative, then today we will discharge them. So they have to go through 14 days of quarantine. And the last is with regards to the discussion. Obviously, we look into not only for the company, but other companies as well, looking into the welfare, the health issues, then the safety issues of the workers. So we are discussing using two acts, for example, Act 446, looking into their accommodation, their welfare, and their health. And we are also using Act 342 to look into the environment, look into the transmission of the infection among the foreign workers. So we are discussing in details in terms of the providing a safe environment for the foreign workers in our country. So I think that's even during the second wave, we have discussed about this issue with regards to the illegal and also the legal. So now we are looking at legal foreign workers, and we need to provide a conducive environment for them. And it's actually a win-win, a sustainability for the company, because without the workers, then the company will have issues. And today, certainly those who do not comply to the Act 446 and also the Act 342, you can see multiple issues they have to deal with. And that also will jeopardize their operation and also production in their company. So I think this is something that we need to re-look back again, how to provide a conducive environment for the workers. Thank you very much. So you look into the top glove, the company, the cluster Teratai. At the moment, yesterday, we have 31 cases, positive cases. So to add on 4,124. And we have done this test for 6,553. So in the location in Selangor, we were informed about 11,215 individuals need to be tested. But Top Glove the company is not only in Selangor, but also in other states as well. So our target is to screen everyone in the high-risk group, and then and hopefully that is we also encourage all today, for example, all the 4 clusters you have been reported, they are all from the workplace. So I think the workplace testing is necessary, and we need to test them periodically. So I think this is inclusive of the cluster Teratai today. So this is what we are doing. So we give us another week or so. So in stages that we screen them, those who were already screened, already quarantined, probably 2 weeks already. But those is still undergoing the screening, testing. So you cannot test everyone, 11,000 in one day. So you have to stretch it out in terms of 2 weeks or even 3 weeks. So the process is ongoing.